Hello, my well-being buddies. It's Steve here, the mental health nurse, and we're going to look at personality disorders. So, in this session, we're going to cover what personality disorders are, what causes them, some of the associated risk factors, some of the signs around personality disorders, what to look for, how personality disorders are assessed, treatment options for personality disorders, and again, medical interventions for personality disorders. So it's important to say that a personality disorder is a mental health condition, and it's characterized through thoughts, feelings, and behaviors, which is what forms our personality. And again, it looks at culture, society, cause of distress, and impairment of daily functioning. So personality disorders are typically diagnosed in adulthood, and they're believed to develop during childhood or adolescent years. And there are several different types of personality disorders, and we'll just run through some of those just so you've got an idea. So we've got borderline personality disorders known as BPD, narcissistic personality disorders, antisocial personality disorders, obsessive-compulsive personality disorders, avoidant personality disorder, dependent personality, and schizotypal personality disorder. So the symptoms for a personality disorder can widen per individual, and it includes difficulties with interpersonal relationships, lots of emotional deregulation, impulsivity, distorted thinking, perception, and really problematic coping skills. So therefore, the treatment for this can involve combined therapies such as medication and goal setting, dialect behaviour therapy training, and adjustments to their quality of life. The cases of personality disorders are not fully understood. The causes of personality disorders are not fully understood, but they're believed to be involved in complex play between genetics, environmental, and biological factors. So some of the causes here are around genetics, and personality disorders may be more common in individuals with family history of disorders. Childhood experiences, so looking at trauma, neglect, abuse, and that's all linked to developmental issues around mental health concerns. There could be some brain development dysfunctions going on. There's differences in brain structure and functioning, and cultural and social differences. The exact number there of people with personality disorders is difficult to determine. So therefore, the prevalence is quite difficult to estimate. However, in the last research that I found, it was up to 10% of the population may have a personality disorder of some type. So therefore, it's important to note that personality disorders can be difficult to diagnose and to treat, and often require specialist care from mental health services. So we'd be looking at your secondary care services for that. If we look at some of those risk factors associated, so if we think about the genetic side of things, personality disorders can be more common in people with possible genetic problems. So again, that can increase the risk of that personality disorder. Childhood experiences are going to be quite difficult because, again, the risks around any level of trauma is going to be flashbacks. It's going to be around that dysfunctional regulatory mood bit. And again, that means there could be episodes of self-harming, or there could be suicidal ideation. So just be mindful of some of that. And equally, there could be lots of poor risk-taking here. And again, there could be substance misuse going on, helping to manage or self-medicating. And it's important to note that not all individuals are going to carry that risk. But again, if you're going to assess somebody for a personality disorder, if you're working with personality disorder, it's important to identify those risks. So the science of personality disorders really goes back to the type of personality disorder that we're looking at. But your typical signs then are going to be things around that poor emotional regulation, dysfunction, poor emotional management of your feelings, on-off relationships, kind of blowing hot and cold. It can all be good one minute and all be bad the next, and there'll be very little time in between. You can have episodes of really positive thinking and then episodes of really negative thinking, and then it switches back quite quickly. The assessment of a personality disorder is normally a comprehensive evaluation from psychiatry, and they'll be using the DSM-5 criteria or the ICD-11 criteria. And the DSM-5 criteria for the personality disorders includes 10 different diagnoses through paranoid, schizoid, antisocial, borderline, narcissistic, and obsessive-compulsive, where the ICD-11 criteria also looks at similar behaviours. So again, if you look at the ICD-11 and the DSM-5, you'll see a bit of similarity there in how they're assessed. So how can we treat these? Well, there are no single natural ways to treat a personality disorder. Some of it could be just managing those symptoms, but a lot of what I'm going to give you is evidence-based treatment, and it's all about supporting recovery and promoting overall well-being. So that will be involving really giving somebody the tools to manage that feelings and that emotional regulation. So DBT might work really well here, because DBT looks at saying that not everything's black and white. It looks at that piece around acceptance and about managing risk. But equally, we can teach mindfulness, grounding skills, safe space, crisis plans, just to manage those spiraling thoughts. Yoga or exercise to help re-regulate breathing and promote quicker recovery. A good nutritional diet, kind of cut out all the junk foods and stuff, and trying to have a well-balanced diet to improve body fitness and mental well-being and stamina. And again, there are other things there that can be used as well, such as cognitive behavior therapy or other types of therapy from your IAP services or your secondary care services. So it's important to note that actually you need to have a well-balanced lifestyle, a reduction of alcohol, a reduction of any substances that could be causing problems. So medications aren't really typically used in primary care to treat personality disorders. However, medication may be helpful to manage the symptoms associated with this. So again, if we go back to the common symptoms that this is going to cause, it's going to cause that anxiety piece, it's going to cause that depression piece, it's going to cause that fight, flight, freeze response. And we know for those type of symptoms, we're looking at antidepressants. So again, you might find your sertralines, escitalopram, venlafaxine, any of the antidepressants might work really well in managing a personality disorder. You may then find that you need to treat perhaps the hallucinations that might go along with this. So they may be hearing things or seeing things, but just come and go. And that altered piece, especially if they have the schizotype. And if they do, then they're probably going to be on antipsychotics prescribed by secondary care. Equally, they may find mood stabilizers really useful to help manage that. And also kind of anti-anxiety medication to manage those symptoms of the anxiety. However, that's normally linked in with the antidepressants because they normally do a dual, they have a dual purpose. But it's useful, it is useful to say that actually what we need to be doing is teaching all of these skills. So if we think about the mood, it's useful to do some emotional regulation training, some emotional intelligence awareness, some coping skills, some problem solving skills. If it's about anxiety, we need to be doing some skills around managing that fear and that panic attack and that thought process. And if it's about relationships, because there's been fear in relationships about being rejected, then we can do some work around rejection. And finally, if there is some trauma there, then you might find some EMDR might work really well, because again, you're managing that trauma and processing that properly. So again, lots of stuff to help the symptoms. And if we help some of those symptoms, we can lessen the stress there. So the other signs for a personality disorder, and again varies, is difficulty in relationships. So if you are in a difficult relationship, people may be struggling with intimacy, trust, or emotional connection. There may be a problem around mood stabilizing, so just up and down. You may find somebody with a personality disorder is quite impulsive, so engage in impulsive behavior that could be harmful to themselves or others through substance misuse. There could be lots of distorted thinking, paranoia. Again, they want this black and white thinking and can take it to the extreme. There could be an unsettled state of oneself. So the way that they see themselves is very dark and not very clear. Lots of negativity there. And then that kind of leads us into that difficulty in regulating those emotions. So if we go back to some therapy work, emotional regulation stuff is going to be helpful here. And then they may have unusual beliefs. So again, through paranoid thinking. And it's important to note that not all individuals with personality disorders exhibit these signs and symptoms. They are just a generic suite. So let's summarize. So what's a personality disorder? It's based on our values, our beliefs, our behaviors, our culture, our upbringing, and the way that we see the world. And it's just slightly off center. What's the cause? It can be genetics, it can be trauma. And again, that can shape the way that we see the world and the way that we think. The risk factors associated, again, we talked about genetics, we talked about the poor negative risk taking, we talked about that impulsivity bit and the risk-taking behavior that needs to be planned for and managed well. Signs, whole heap of signs there through mood instability, problems with relationships, impulsivity and distorted thinking. So just managing that. Going back to the DM5 and the ICD-11 criteria there for it to be assessed through a clinical interview. Natural treatments is all about good self-care, managing oneself and well-being, making sure you've got a good diet, making sure you've got a good support network, making sure you've got a good crisis plan, making sure you've got a good safety plan, making sure you've got good coping skills, making sure you've got good resilience skills, making sure you've got good planning skills. And again, it may be help around social prescribing, trying to help manage all of those bits of life that just become difficult to navigate, that can make you spiral. And then finally, medication. We've just talked about that, looking at the different types of medication. So for example, you may have antidepressants to manage the symptoms of the low mood and the anxiety. You may have antipsychotics to help manage that piece around schizo, whether it's the schizophrenia part, the hallucinations. You may want to do mood stabilizers just to keep somebody on an even level. Or alternatively, there's that piece around other PRN medication to help manage, stabilize. And again, think about sleep as well. That's linked to this. So hopefully that gives you a helicopter tour around personality disorders. And my name's Steve, and I'm the mental health nurse. Thanks for watching.